Lots of new developments in just the last 24 hours in the battle against COVID-19. I want to get to Dr. David Winter from Baylor Scott White Health. It is good to see you today.
Good morning. Good to see you, Sonia.
So first off, a gout medication is being studied as a possible new treatment for COVID-19. So can you give us a background on this and maybe your thoughts on whether or not you think it'll be recommended?
Yeah, the drug is probenecid, been around a long time to treat the gout. And University of Georgia researchers are studying this, and they seem to find the virus doesn't replicate quite as fast in the test tube if you put probenecid in there. Also, early animal studies are promising, so the next step is human trials. Hopefully there'll be the double-blind randomized control trials where they'll take folks who have COVID, give half of them placebo, half of them this, see if there's any difference. So we're going to have to wait on those. Right now, I'm not sure. We've had other drugs that looked like they were going to be promising in those randomized control trials. They didn't really pan out, so keep our fingers crossed for this one.
Yeah, I got to wait for the science. Okay, so we're starting to hear, Dr. Winter, about a new variant of the coronavirus. So I'm talking about the Mu variant. We've confirmed cases recently in Dallas. So what can you tell us about this strain?
Yeah, first, we're not quite 2 years, not even 2 years into this pandemic in the human race, and we're halfway through the Greek alphabet. That's how many variants, how many new strains have come out. This one started in Colombia. It's the dominant virus there. Here it's in about less than 1%, and it looks like it's not near as contagious as Delta and not as severe as Delta, but we need to keep an eye on it. We don't know a lot about it right now because it's brand new right here in the United States.
All right, we'll be keeping our ears and our eyes peeled for more information and data as that becomes available. So hospitals in Idaho are at this point reporting that they have no room for new cases of COVID-19 and they're now rationing care. I know Denton County was full. I reported that earlier this week. What does that mean exactly when you say we're going to ration care? And is that likely to occur in Texas at some point?
Yeah, it's a scary thought, Sonia. Rationing care means there's no room at the inn, there's no room at the hospital. We can't take care of you. And I want to emphasize the fact that if there's no room there, that also affects non-COVID cases. If you come up with acute appendicitis, heart attack, a car crash with serious injuries, you may not be able to get a hospital bed. So this is really serious right now and points out the fact we all need to do our part to try to stem the spread of this virus. I mean, it's in another surge right now. Doesn't look like the peak is over yet. It's still climbing in North Texas. So I'm very concerned about this information when we're rationing healthcare, something doctors and healthcare workers do not want to do.
Yeah. And Dr. Winter, I've heard about Moderna announcing plans for this combined flu and COVID vaccine. So basically you'd get one shot, that would be your flu shot and your COVID-19 vaccination. My understanding is that this is still a ways away, but thoughts on this? Is this a good idea?
Well, on one hand, if you give 2 shots to a person and they have a reaction, you don't know which drug they can't take the next time. So that's a negative. On the other hand, anybody who's been in the military, they'll tell you get 8 or 10 vaccines at one time in induction. So we can do this. That actually works. I think we'll probably do this eventually. I think it makes sense. These are both respiratory viruses. They may work in one vaccine together, but time will tell. They have to study this just like they studied the original vaccine. So more studies to come, Sonia.
All right, Dr. David Winter today with us. Thank you so much. Really appreciate your insight.